My name is Hannah Bailey. I am a treatment coordinator and therapist here at SunCloud Health. I focus on dance movement therapy, provide process groups, some therapeutic yoga. Dance movement therapy is really important for our patients because it helps integrate them physically, emotionally, cognitively, and socially. And it's based on empirical data that shows that the mind, body, and spirit are interconnected. One reason that dance movement therapy is so important with patients who have experienced trauma is that their trauma is lived in the body. And so it brings another way for us to look at it and really notice how it affects them throughout their whole system. Often when patients are first arriving to the program and they hear that we have dance movement therapy, they get a little freaked out. And so one way I try to put their mind at ease is actually by explaining kind of the effect that happens both ways, body and mind. So I often help to educate them on stress and how it affects us mentally, and then how it actually shows up in our body physically. So often I'll ask something as simple as, who's ever noticed that they feel tension or something weird in their body when they're really stressed, anxious, depressed, whatever it might be? Most people raise their hands. And then we just talk about that relationship. And so to let them know right away, we have a new inroad. So if we can't kind of quiet the mind or help create some calm up there, we can try to elicit it in the body and then notice that relationship that happens, how our neurotransmitters then help to cue the brain to also maybe be a little quiet, a little calm, a little something, to kind of help create a shift in a new way. One population I am pretty passionate about is teens. And so when I first got here, before we actually started the PHP program, I proposed adding a teen outpatient group. And so what that means is that it's a group that meets once a week for about an hour, where teens can focus on body image, eating disorder, etc. And I saw it as a need for the community, quite honestly, because what I found is when I worked in the hospital, patients would come in, or teens would come in to these IOP and PHP day programs and find that they really loved group therapy, and then they would get out of it and be like, what the heck, there's no group therapy out there. And so we started a small group. What I've noticed in those that I've been working with is that they have more awareness of their bodies. It's allowing them to realize the connection and realize the way that the whole system affects itself. Their awareness of their body is really important. Helping to repair that at a young age can be a really beautiful thing, because it's really hard sometimes when we get to working with people in addictions when they get to older ages, because the patterns have been ingrained so long as a way to cope with the pain, that if we can get them when they are younger and like really dig into it and work with it in the moment, it's easier for them to continue to live life in the moment. There's something about movement that I don't think people quite realize how powerful it is, but it's what we do all the time. We walk from point A to point B, we move our head to look at things, we're always moving. And so the more we realize how that some intentionality can be added behind it, the more successful we can actually move through our lives.